Committee, Thursday, November 7th, to order. First order of business, we approval of the minutes. Do we have a motion?
Motion. Second.
Motion and second, any discussion? All in favor? Open up for public comment. Seeing none, close public comment. I'm gonna change some stuff around on the agenda, and the hazard of duty benefit that's on here, we're gonna talk about it at last. And we are also going to remove from the agenda discussion of the office renovation, at the sheriff's office. So, first, sheriff's report.
Yes, I mean, we're going to start with number 3 if you want to.
Okay.
We're going right on into it.
Go ahead.
Over the past several committee meetings we've had, we've talked about our, you got a copy of it? Our hospital negotiations we've been having with our local hospital. We're to the point now where we met with them again last week. And we're pretty much at a stalemate is what I'm seeing. We're not, we can't agree to this agreement, and they're not gonna back off of it. There's been some suggestions that maybe some commissioners and the mayor, some might wanna meet with some of the higher ups at Vanderbilt, but we'll just have to wait and see, but this is not going nowhere. And once we told them we wasn't gonna pay, wasn't gonna sign this agreement, they said the cost goes back up to 60%.
That one's the one that's something.
Yeah, that's where we stand today. We've been in talks with Summit Hospital for several months now, trying to negotiate a better price. As many of y'all know, we have a Summit ER right down there off Interstate in Mount Juliet. It's Goldenberry, right there close. Beckwith, and it's there for our use. They've been very cordial in meeting with us, and they've come to us with a contract, which I think we're pretty close on, Mike. There's some things that I think he may have saw that maybe need to be redacted or something. And
You talk about that. They all right with you?
No, sir, I have not. I went over your comments with the sheriff.
Oh,
and,
okay.
And then the medical provider had 2 little bitty things that I think will be very easy, but I think the sheriff wanted to bring it in front of the committee tonight. And then I'm ready to go meet back with Summit and try to iron those out, but.
which I think it can be ironed out, I really do. They want our business, and their percentage is what, 40?
40.
At 40%.
What was Vandy's?
It was at 45.
Yeah, way back to
Then we went back
60.
60 when we didn't play ball with them.
Yeah. They won't come off that.
No, I just don't see it. Now I'm saying that it's, Summit is a local hospital.
Yeah.
And this just gives us another option. And listen, if it's emergency type case, we'll still have to go to Vanderbilt because it's the closest. But non-emergent type cases, we can direct them down to Summit, and that way we got 2 options. And I think this is just the beginning. I think we need to move in this direction.
Mr. Chairman,
Yeah.
may I address?
Absolutely.
This is, you correct me wrong, this is for the prison, which we're direct pay, which comes out of our revenues for the county. We have to pay for that directly. Okay, anything to do with the insurance or employees, just the prisoner, cost of the prison.
That is correct.
And as I remember correctly, part of this contract anyway was 45% here, still 60% in Nashville.
That's correct.
And I won't say most, but most of the inmates go here and then get shipped to Nashville. So they're gonna get 60% either way.
And I'm hopeful that the mayor and I can go see Wright Benson, the head of Vanderbilt, and address this with him and hopefully get some grace in it. Who knows?
Here's the sticking point, okay? There's, in the contract that Vanderbilt has sent us, it says that the county would be responsible for every prisoner that comes through their doors. Whether Mount Juliet, Lebanon, Watertown, TBI, Highway Patrol, anybody, the county would be responsible for that people.
Travis County.
It's pretty open to me, and I can't sign contracts anyway, it's up to the mayor and finance director, but you know the cost of that? That'd be outrageous.
That don't even make sense. It doesn't. That's what I like about it.
And
Why won't they change that
we-
language?
We've tried, and we've tried, we just,
Yeah. You need a motion, anything,
I
something?
mean, I'm just gonna get, I just, now, well, I'd like to get y'all's blessing saying, hey, move on with this Summit contract, get negotiated, get it done, have a second off,
We have a motion to authorize the sheriff and chief to move on with Summit Hospital and negotiate the contract and come back to us.
Get a motion.
Second.
Motion second, any further discussion? All in favor?
Lance, I'll let you take the next one. TCI grant.
Mike, could I ask you a question?
Yes, sir.
I know you ran this thing in and out, but is there a possibility of offsetting the hospital costs by bringing in a mobile clinic and doing anything that wouldn't require hospitalization?
They, we do have a medical company in-house in our jail. They've got doctors, dentists, psychiatrists, nurses, 24 hours a day. They're in-house already. These are the ones that can't be treated. So these are the sickest. And we're getting more and more, seeing that inmates are sicker every day.
This first one is a pass-through grant, Tennessee Corrections Institute Office of Training grant, and we needed some money to replace some air conditioning units, HVAC units at our training building out at the fairgrounds, and this is gonna pay for just about all of it, $15,000. The contract's already been signed by the mayor. We're waiting the state to sign it, send it back, and as soon as we do that, we've already taken quotes. Got a low quote from a local to replace the 2 air units. And so we'd ask you to approve that money, so that's $15,000 coming in of new money, putting it in our building maintenance fund, and then be paid back out. We're gonna add about $700-800 to it. The total bill was, the cheapest bill was $15,700, I believe. Randy's Heating and Air. And so.
Motion to approve.
Second.
Do we need 2 motions on that or not?
But you gotta
The money
accept the
to
grant.
accept the grant and approve the spending?
Well, I mean, if they've already got the other money in your budget, you won't need to do anything. The grant's what you accept.
Okay. All right.
You're not gonna have to-
If you accept the grant, you're gonna allow the money to come in and put it in.
Right, but they're talking about the extra 700, it's gonna come out.
It's
of
already
your
in my budget.
Okay. You just need to.
Got a motion and second to approve
Who
the,
seconded it? Boy, you on a roll, man. You 3 for 3.
any further discussion? All in favor?
We need to, for the grant, accept the grant and add it to the line.
No, that's what I was asking, we did not
I'm
have.
talking about the 15,000.
Well, you will need a budget amendment, right?
That's what I'm saying.
15 We are
That's what
adding
I was asking
15,000
about.
to, we
Yeah.
are adding the 15,000 to the
We need a
budget.
budget amendment for it.
So we do need the 2 motions, right?
We'll just do do we need to accept the grant?
I do need an acceptance on the grant. The mayor has signed it, but to make auditors happy, y'all accept the grant and approve the appropriation.
Yeah.
Motion to accept the grant.
We got that, we just need to, I did the first one, accept the grant and also do it for the budget amendment to put the money into the.
Right, so now we just, the motion, you made a motion for the
Second.
budget, approve the budget amendment.
Right.
Second?
Second.
Got a motion and a second to approve the budget amendment, all in favor?
Aye.
Yeah, we'll have to let me catch up. 'cause
Yes, sir.
That ain't what y'all did.
I didn't think that's what we
Yeah,
did.
y'all made a motion to approve what he passed out, and that got approved. So the next motion needs to be to approve the grant,
Okay.
and you need to let me catch up. That's the biggest thing. All right, WG made that grant, who seconded that? Chris Down. Todd. He's been very active in government today, this is his third meeting.
We're proud of
Good job, Chris.
So,
Good.
45 minutes.
I sure will. There's the other guy over there.
SRO supplement.
It's either
thanks
you
for
or
that.
me.
We're throwing rocks.
It was either you or me, Kevin.
This next one is part of the governor's budget, and we didn't bring this forward earlier because we didn't know how many SROs we would have that would meet the qualifications, but this is additional funding, part of the governor's 23-24 budget. And now it is for the 23-24 school year, so any SRO that was eligible that had the certain criteria for training gets another additional $800 supplement. So we had a total of, at the bottom, we had 44, that's correct. And so this would make that money coming in from a law enforcement training program and adding it to salary supplement. So it's not a grant, it's a strict budget amendment, and this is just pass-through money from the state.
Motion approved.
Motion second. All in favor?
Is that what I used to get at sea?
This last thing is just a notification to the county governing body, and it will be in the packet for all the county commissioners during the November meeting. I went ahead and dated this letter November the 11th, which is the Ada County meeting. And this is just to notify y'all that we will be asking for surplus property or law enforcement property from the DMRO, demilitarized program. And this was part of an executive order back in 2022 that we have to make you aware that we could ask for these items. And then once we do that, we will post it the following day for 30 days inside the courthouse for anybody, for the local community to see. If we had an objection, they'd have to bring it in front of the county commission, what their objection would be, and I don't know that process, but I guess we'll figure it out if we had an objection. And this is just notifying y'all that the sheriff's gonna submit this letter.
Motion approved.
I think we have a motion on that, do we? It's just a notice.
It's just a notice.
I got you, I got you.
Okay.
I want you to start with number one there and
Yep.
talk about it.
So, CTAS, I think Chief Howe's gonna pass out the CTAS document that I guess they're making all governments aware about a hazardous duty supplement retirement benefit that would apply both to law enforcement, corrections, and firefighters, so the Denver Sheriff's Office as well as WEMA. And it's basically, and all we're doing today is putting it out on the table for y'all to read about, discuss. We're not looking for a motion, we're not looking to approve anything, but it is something that we could look at to provide for first responders and that the county, overall, the county would be responsible for the increase in the supplement, which I think is somewhere around
0.375.
about 0.4% is what the increase, but it's also a multiplier based on the service years and salary. So it's a case by case, not everybody's gonna get the same amount. It's all based on their TCRS status. And I think there is a difference too between what type of plan you're on, whether you're on the legacy or the hybrid as well. Lance, when you now discuss it, is there anything that I missed, just throwing that out there?
It's not retroactive, so it requires the county to do a plan through the finance office with TCRS, number one. If you wanted to entertain that, and that would give you your cost basis of what it would cost. Secondly, it would only be eligible if the county did the study and agreed to fund it. Then once a resolution passed, it would only apply to any retiree after that point. Nobody could be back prior to that. And it only provides a benefit, if we're reading it correctly, let's just say an employee retires at 55 with 30 years of service with the county. He's retirement eligible, he would draw his normal, but once he turns 60, the multiplier would kick in between 60 and 65 or
65, I believe
67.
is how I read it, depending on what your
What your full retirement
full
scale
Social
is.
Security retirement date is.
And so if you started early retirement, don't really understand how that works, but it's really mainly designed for an employee to retire at 60.
With
and
20
get
years of credible service.
Minimum 20 years credible service. And he would get a multiplier of, instead of the 1.515, he'd almost get 2% for 5 to 7 years, and then it would revert back when he started drawing his full pension of Social Security, or full Social Security benefit. So, again, don't know the cost. It would be up to finance to coordinate with TCRS. I'm sure the mayor's office and finance to get the study done, but I think that's every county has to do it. It's an opt-in or opt-out, I'm sorry, an opt-in only, and the county is required to fund it, so if it was to go forward.
So that percentage, what would that be? Like $50 more a month or $75 a month or what?
Depends on what the top 5 is. The top 5 on a $50,000 employee or $60,000, $70,000, it's just gonna depend what that extra multiplier would be, the .375. And whether you're a 20-year employee, a 30-year employee, so it's gonna depend on a lot of different factors. That's the reason the study's required to get an accurate, it's my understanding, Aaron would have to correct me if I'm wrong, but I think what they do is take an approximate point the county would approve it. Any eligible law enforcement, corrections officer, firefighter, they would pull those names, and they've got a formula, TCRS already has it, so they would calculate up what the cost probably would be, and then the county would have to change, if they approved it, would have to start paying that higher multiple to offset that cost when they did retire.
I just skimmed it real quick, but it looked like it said we had to hire an actuary to determine.
That's what it says. I was hoping maybe TCRS had one they'd lend us. So, just discussion right now, and then if anybody has any more questions, if not, kind of read over it, and we'll bring it up at some later point to see what we want to do with it.
I think it's a good time to look at this, especially when we're evaluating the salaries of our staff. The whole benefits package anyway with all county employees. It's a law for a reason. I mean, it's clear why the state made it law. A lot of states do it for hazardous duty pay for these people in these high-risk positions. And I get why it's important for them to be able to have a little bit of buffer to early retire and then until their Social Security kicks in.
But the rate that we get for retiring under the system is so under every other state just
Okay.
about in the entire nation. This is a small percent, but it also helps.
Yeah.
Because we got all the training we've all been to, that you go somewhere else and they're getting 75, 80, 90, 100%
Oh,
of
yeah.
what they make. And we're 47,
Right.
if you take the very,
There's been, for the past 2 to 3 years down at the legislature, there's been sheriffs and chiefs have been put on committees to figure out how to improve the retirement system for law enforcement and now firefighters. And there's a bridge plan from that
THP.
that THP and a few other agencies across the state do. But I think what they recognize is a lot of these counties can't afford this bridge plan, so they added this in as not as higher level, less cost. So a lot of counties across the state would be able to possibly afford it, so that's where this come out of.
And the age 60, I believe, came out of what the bridge
It did,
plan
it did.
kind of requires.
Exactly.
So,
Well, hopefully there'll be something soon we can vote on to get that.
yeah, well,
The study
I
going.
didn't really want to, I think there's a lot of information in here, and I think finance needs to look at it as well, just to get kind of their head wrapped around it, and then
Yeah.
we'll bring it back up.
I'm like you though, we need to make sure that we address it during the pay plan.
Sure.
So if we're gonna do it, we can do it as we increase the salary, or whatever we're gonna do at the same time. So it's kind of,
I
we
don't
can plan
disagree.
for it.
And in here it says this can be effective January 1. Of course, it requires a commission to fund it and do it, but the way they passed the bill, any county that wanted to opt in, it will start January 1 of 25, effective that calendar year.
You want to send a packet to go out, or you want to wait till?
Oh, yeah, put that, yeah.
So everybody got a chance to
Everybody got a
look at it?
chance to look at it, it's a good idea, thank you.
Is CTAS done a study too, or does it just come out of MTAS?
It was a joint study, but
CTAS and MTAS both were on that committee down in
Okay.
Nashville. I know they had a chair at the table.
That's all, I think that's all we have on the agenda. Have another motion.
Motion to adjourn?
Second.
Second.
We're adjourned.